the 4-chamber view of the fetal heart. During standard obstetrical ultrasound evaluation, several views are used to image desired cardiac anatomy. The 4-chamber view is obtained during every standard examination. If technically feasible, a left ventricular outflow tract view and a right ventricular outflow tract view are also obtained. The 4-chamber view is described here. This drawing shows a fetal chest and heart. The 4-chamber view is an axial or transverse image through the fetal thorax at a level just above the diaphragm. It allows evaluation of cardiac size, position in the chest, and cardiac axis, as well as evaluation of cardiac chamber size, cardiac septa, and atrioventricular valves. As shown in this diagram, the heart occupies approximately 1/3 of the area of the thorax in the 4-chamber view and is positioned on the left side of the thorax. A shift to the right may indicate a space-occupying mass in the chest. Cardiac axis is the angle that the heart makes with the anterior chest wall in the 4-chamber view. From the spinal ossification centers to the anterior chest wall in the midline, a line is drawn. The axis is the number of degrees the apex of the heart deviates from this midline as it points to the chest wall. Normally, the apex forms a 45-degree angle with the left anterior chest wall, plus or minus 15 degrees. Many fetuses with cardiac abnormalities, especially outflow tract anomalies, show cardiac axis abnormalities. For example, the image on the left demonstrates normal cardiac axis, whereas the right image depicts left axis deviation, with an axis almost 90 degrees from the midline. As noted earlier, the 4-chamber view allows evaluation of chamber size, atrioventricular valves, and cardiac septa. The right ventricle is the chamber closest to the anterior chest wall and contains the moderator band. The left ventricle forms the apex of the heart. Both ventricles are symmetric in size. The right atrium and left atrium are also easily visible in this 4-chamber view. In this sonogram, the tricuspid valve separates the right atrium and the right ventricle, whereas the mitral valve separates the left atrium and left ventricle. The interventricular septum separates the right and left ventricles. The atrial septum primum arises from the crux of the heart and projects into the space between the left and right atria. The foramen ovale permits flow of blood between the right atrium and left atrium, thereby bypassing pulmonary vasculature. Lastly, vessels that may be seen in the 4-chamber view include the descending aorta and 2 pulmonary veins entering the left atrium.